important documents and tips in filing a winning long-term health care claim, Part 2. Now, in the first part of this series, I covered information about the policies, statements, nursing assessments, and care plans, and provider statements. Now, if there aren't enough forms, there are some more forms we're going to be talking about. Now, if you're receiving long-term care services, each care provider has to complete and sign a form to verify that the facility and that the provider are equipped to provide the services that are outlined in that plan care document. Now, many policies will require that the care be provided by a qualified provider at a qualified location. And because of this requirement, many in-home care companies or assisted living facilities or skilled nursing facilities will have to complete and sign these forms that confirm that they are licensed, that they are certified, and that they're otherwise qualified by the terms of the policy to provide care. Now, you should be reading your policy closely in regard to what those qualifications are, particularly for an in-home provider, and particularly if they're a loved one, because that's another area of dispute. You might be surprised to learn that your loved one, your relative or friend has to be qualified or licensed to provide care under the terms of the policy. They just can't come in and provide care. The provider statement has to be signed and certified that that information is accurate, including the home care. There is another important term in the policy that we talked about, and that's the elimination period. And you have generally in a policy an elimination period that has to be satisfied before the long-term care provider has an obligation to pay. Now, some policies have very specific requirements as to the elimination period and the fact that it's only satisfied when you have received or paid for care out of pocket during the elimination period. And as a result, there's more documentation that you're going to have to submit. You're probably going to have to submit documentation for payment of services, including invoices, so that the long-term health carrier can see and confirm that you've satisfied the elimination period before they have to pick up $1. Now, once that elimination period has run, then the long-term carrier's obligation to pay begins, and they don't want to start a second sooner. The next document is authorization to release information. Now, obviously, they've got to collect medical and financial documentation to process your claim. So as a result, you're going to most likely have to sign a HIPAA-compliant authorization to release your medical information so that the long-term care carrier can collect those records from whatever provider is appropriate, and they'll need that to process your claim. If you have a legal representative, that representative is going to have to sign the authorization form and submit a copy of their power of attorney, POA, or guardianship documentation. So now that we know what the covered documents are, let me give you some tips for submitting these documents. The best way, in my view, to submit the documentation is with a cover letter that lists all the documents that are enclosed and sending it in certified mail return receipt requested, or by sending it in email with a request for a receipt. When all the appropriate forms and paperwork have finally been submitted, a care coordinator with the long-term care carrier is going to typically call you or your legal representative. The care coordinator is going to want to schedule a telephone interview, and generally they're going to make a decision once they've completed all of this within 30 to 45 business days. If you haven't heard from a care coordinator within 10 days of submitting the documents to the long-term care provider, you should be on the phone with them. Obviously, this can be pretty complex and it can be confusing. If you have any questions about this process, or if your claim has been denied or your benefits terminated, call us today at 727-894-3188 for a complimentary consultation. We can help you regardless of where you live in the United States, regardless of the nature of your disabling medical condition, and regardless of that particular carrier. 727-894-3188.